Hello and welcome everyone. Today we are discussing about fallopian tube. In this video we are going to discuss about anatomy, histology and pathology related to fallopian tube. Introduction. The fallopian tubes are bilateral conduits between the ovaries and the uterus in the female pelvis. They function as a channels for oocyte transport and fertilization. They are 11 to 12 cm in length and have a lumen diameter of less than 1 mm. Fallopian tube comprises 4 anatomical regions. First is uterine or interstitial region. Second is isthmus. Third is ampulla and fourth is infundibulum with fimbria. Most medially, the uterine part includes the uterine ostium and the short segment nearest to the uterine horn. The isthmus is adjacent to the uterine part and lateral to the isthmus is the ampulla, the most common site of fertilization. Most distal from the uterus, the infundibulum ends at the abdominal ostium opening up into peritoneal cavity, and fimbria which catch the released oocyte during each menstrual cycle. The arterial supply to fallopian tube arises from anastomosis between ovarian and tubal branches of ovarian artery and ascending branches of uterine artery. Ovarian arteries supply the lateral fallopian tube while ascending branches of uterine artery supplies the medial fallopian tube. However, anastomosis between the two generally ensures the compromise of either will not cause ischemia of any portion of the tube. The venous drainage goes to tubal branches of the uterine and ovarian veins in a similar configuration as the arterial supply. The inferior vena cava receives the drainage from right ovarian vein while left renal vein receives the drainage from left ovarian vein. The uterine veins drain into the internal iliac veins which drain into inferior vena cava. Lymph flows from the fallopian tube to both para-aortic lymph nodes and pelvic lymph nodes. Now let's learn the histology of fallopian tube. 4 layers are there in fallopian tube. First is mucosa, which is highly folded longitudinally. It has ciliated columnar cells, secretory cells and intercalated cells. Second is lamina propria. Third is muscular layer. It has 2 layers. First innermost is circular and the second outermost is longitudinal muscular layer. And fourth is serosa, which is mesothelium of visceral peritoneum. This picture shows cross section of isthmus. Here you can see the lumen is narrower, mucosal folds are less and the wall thickness is high. This is the cross section of ampulla. Compared to earlier, the wall thickness is less and here the lumen is larger and there are more folds as compared to isthmus part. This is the cross section of infundibulum which consists of fibromuscular core and surrounding mucosal folds. Epithelial cells. This image shows ciliated columnar epithelial cells and secretory cells in the mucosa of fallopian tube. Let's see the pathology related to fallopian tube. First is benign lesions. They are chronic salpingitis, tubal obstruction, ectopic or tubal pregnancy, metaplastic changes, hydrosalpinx, hematosalpinx, tubal rupture. Now let's see the pathology involving the tumor of fallopian tube. Benign tumors and malignant tumors. Benign tumor consisting of endosalpingiosis, tubo-ovarian abscess, metaplastic papillary lesion, placental site nodule, salpingitis ischemica nodosa, and malignant tumor pathology consisting of adenocarcinoma, serous carcinoma, papilloma, sarcoma, teratoma. So this is in short about fallopian tube and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.